I'm still Dr. Abdulaziz Kolaole Muslihuddin, the CEO, Leading Care Integrative Medicine. In my previous video, I've explained hypertension and the need to talk about hypertension at the moment. In this video, I'll be talking on determinants of hypertension. I've discussed in a previous video. You can search for it on our channel, on our YouTube channel, to know the content therein. I've said in the video that we have two types of hypertension, the essential and the secondary. Determinant of hypertension that I'm about to talk about here are determinants of primary hypertension, determinants of essential hypertension. What are the causes of essential hypertension? Let's move on. So the following factors determine the blood pressure. We have the blood viscosity, the TPR, the total peripheral resistance, blood vessel wall elasticity, change in blood volume, and cardiac output. What do we mean by blood viscosity? It means the thickness of blood. Blood has its normal thickness. If blood becomes too thick, it is a problem. And what causes blood? What causes blood viscosity? You have a number of things that causes cause blood viscosity. One of them is dehydration. So you have to take note of your dehydration. If you are the type that you have been diagnosed to have hypertension, a very high BP, so you have to take note of your dehydration, because dehydration can lead to blood viscosity, and blood viscosity will make the blood to be thicker, leading to high blood pressure. And among the causes is the blood sugar level also. And as I'm going to explain further, perhaps in my next video, some blood groups, for instance, blood group A and blood group AB, they have tendency of having blood clotting. So more than other blood groups, that is blood group O and blood group B. So blood viscosity is one of the determinants of hypertension. And we have the total peripheral resistance, that is a particular resistance in the blood vessels. We've discussed blood vessels in our previous video. So a particular resistance in the blood vessels, if there is resistance in blood vessels for a very long time, it may cause the vessels to burst. And if the vessels it now depends on the vessel, the area of the vessel that has the resistance. Is this in the aorta, or the vessels is the obstruction? The resistance is called the obstruction. The total obstruction found in blood vessels. So it will determine, it leads to blood vessel high blood pressure. So it now depends on the area where the blood vessel, the blocked blood vessels are found. If the vessels are in the aorta, it may cause sudden deaths. If the vessels are found in the respiratory organ, it also can cause anything that can cause any life-threatening diseases. So we also have blood vessel wall elasticity. So it's part of the determinants of blood pressure. If arteries or blood vessels become rigid or too rigid, they are not elastic enough, to contrast, so it will lead to high blood pressure. The same thing goes with the change in blood volume. So blood volume can change in line with a number of things. For instance, if you have kidney failure, kidney failure will make blood in the blood vessels to become larger. So the volume of the blood in the blood vessel will be more, leading to high blood pressure too. So that, and we also have cardiac output. And cardiac output is the total amount of pumped out blood in one's heartbeat. So this also is one of the determinants of blood pressure. So for now, high blood pressure factors, as said, now we have high blood pressure factors. We have high viscosity, high TPR, that is the total peripheral resistance, rigid blood vessel wall, high blood volume, then high cardiac output. On the flip side, the opposite side, are the determinant of hypotension, low blood pressure. So you have low blood viscosity, low TPR, a very low TPR, elasticity or elastic blood vessel wall, and low blood volume and low cardiac output. These are the determinants of hypertension. So now moving to therapeutic windows to curing hypertension. What are the ways if you want to cure hypertension? That's your hypertension that you've been managing for 10 years, 9 years. No, you don't need to live on drugs. Investigate root causes and tackle the root causes. Then you are fine. You are okay. Now, if you have hypertension, you are just taking drugs for more than 10 years, 5 years, 7 years, and you are not looking into your blood vessels, into your organs. Where is the problem coming? Where are the problems coming from? So that's how you continue with your drugs till you die. So the therapeutic windows, what should we do to cure our hypertension and to get rid of the drugs? 1, you take cognizance of the above points, all what has been said so far in the previous video. In this video, take cognizance of them. For instance, dehydration and the likes. So, and I'm still going to talk on some other things too. To cure hypertension, you must take care of the blood vessels. The total peripheral resistance is there. You must take care of them. You must not allow any obstruction to happen in your blood vessel, because the heart relies on blood vessels and the heart works with them. So again, identify your blood group and know what provoke hypertension in you to better prevent or cure your blood vessels. As I said, also under viscosity, I said blood group A and blood group AB, they have high tendency of having blood clotting. That is, they have high tendency of having hypertension. They have high tendency. If you are a blood group A and blood group AB, be on the watch and be in the know, stay in the know to know what provoke your hypertension. If you've been diagnosed already, if not been diagnosed, know how to prevent hypertension, what to do and what not to get close to. Now, because each blood group has different ways they influence the gene around them to create diseases and ailments, including hypertension, diabetes, cancers, and so on. So let us be in the know, stay in the know, and know what is good for you and what is not good for you. Tips on getting accurate hypertension diagnosis. If you want to measure hypertension, or you are going to the clinic, what to note and what to tell. Although if you want to tell your nurse or your doctor, they might not want to listen to you, or they might not want to lend you a listening ear. So, But especially if you are testing it at home, if you've been diagnosed to have hypertension, please get a machine and do it your own. Do it at home. Tips on getting accurate hypertension diagnosis. Do the following. Number one, before you measure in the clinic, at home, anywhere, make sure your bladder is empty. If you have full bladder and you are measuring your BP, it will add to the pressure of the reading. So empty your bladder before you measure your BP. Then have at least 25-minute rest before you measure. If you are going to the clinic to measure, on getting to the clinic, get somewhere, sit. Because when you just go to the reception or to the doctor straight, or the nurse, because people are many and she want to get rid of you in no time, she will not ask you when did you come. No, she just measure you straight and give you diagnosis. No. So hide somewhere, sit somewhere. After 25 minutes, 20 minutes, go to her, go to him, let him measure you. So at least you need to have 25 minute rest before you measure. Then rest and support your back. Place your hand on the table such that the arm levels with the heart. Don't cross the legs. Put your feet flat on the floor. Use the correct cuff. You know, you have different types of cuffs. We have cuffs for children, we have cuffs for young adults, we have cuffs for obese people. To use the correct cuff. You know, when we're talking about cuff, we are talking about that thing that used to the clip to your arm. So use small for the children, large for adult, and extra large for overweight or obese patients. And in fact, this cuff also cause problem in reading. If you use wrong cuff, you have wrong reading and wrong measurements. So if you use large cuff for a child, so you have wrong measurement. If you use small cuff for an adult or overweight patient, so you are going to have wrong reading, and that is where most of these things happens in the clinic. So don't wrap cuff over clothing. Avoid distractions during the reading. You are measuring your BP and you are listening to music, you are listening to news. No, you are dancing. No, it's not good. Avoid distractions. Measure both the right and the left arms, especially when you have a resistance, but hypertension resistance. You have been nursing hypertension. You have different measurements in the day, in the weeks. You have problems with hypertension, with your blood pressure measurement. Make sure you measure both left and the right. Measure both left and the right. So that's that about that. Another thing I have to say also is that don't use one measurement to diagnose yourself to be hypertensive, and don't listen to any doctor or nurse that measures you only once and said go and start using this thing. No, at least you have three different measurements, and on that you take the average. There's a way you take average. You average the measurement and get your diagnosis. Is it pre-hypertensive, mild, severe?